What is subjective versus objective data in a therapy report? Imagine trying to understand how someone truly feels and how they perform during speech therapy. It's like putting together a puzzle with two different kinds of pieces. One piece is based on what the person or their caregiver reports, and the other is based on what the therapist observes and measures. These two types of data help create a full picture of progress and challenges. In therapy reports, subjective data refers to information shared by the client or caregiver. It includes feelings, perceptions, and personal experiences related to communication or speech. For example, a child's parent might say, "My child seems more anxious when speaking in groups," or a client might report feeling frustrated when trying to say certain words. This kind of data isn't something you can measure with a ruler or a test score. It's about understanding the emotional state, motivation, or external factors that might influence therapy. Caregivers often notice changes in behavior or mood that the therapist might not see during sessions. On the other hand, objective data is all about facts and numbers. It is collected by the therapist during the session and is measurable. For example, the therapist might record that a client correctly pronounced a target sound 75% of the time, or that they completed a specific task with minimal cues. Standardized tests or assessment scores are also part of objective data. This information is clear and unbiased because it focuses on what can be observed and counted. In therapy reports, the subjective section might include notes on how the client felt during the session, if they seemed more cooperative, or if they reported feeling tired or anxious. The objective section would detail how many words they said correctly, their participation level, or the results of specific speech tests. Understanding the difference helps caregivers and teachers interpret reports better. They can see what the client or family reports about their feelings and experiences versus what the therapist has observed and measured. This helps everyone work together more effectively. It also guides the therapist in planning future steps, whether that means addressing emotional barriers or focusing on specific speech goals. In summary, subjective data gives the personal story behind the numbers, while objective data provides the measurable evidence of progress. Both are important for creating a complete picture of how therapy is helping and what might need more attention. This balance supports better communication between therapists, caregivers, and educators, making sure everyone understands the full story behind the therapy journey.